You've probably known for a long time that living with type 1 diabetes isn't just a medical condition, it's an emotional one too. But even after decades of research, many people with diabetes feel like that part of the conversation hasn't fully caught up with their reality. My name is Scott Johnson, and today we're talking with Dr. Bill Polonsky, a diabetes psychologist who has spent his entire career studying the emotional burden of diabetes. In this conversation, we're exploring what we've learned over the years and what conversations still need to happen. But before we continue, I do need to remind you that we're not providing medical advice. For personalized guidance, we'll always encourage you to talk with your personal healthcare team. Additionally, Blue Circle Health does not endorse any specific product brands and encourages you to discuss those details with your personal healthcare team. Dr. Polonsky is a clinical psychologist who's spent his career helping the diabetes world better understand the emotional side of this condition. He's the co-founder of the Behavioral Diabetes Institute and a pioneer in research on diabetes distress and burnout. Dr. Polonsky, thank you so much for being here. I'm really looking forward to this conversation.
Thanks, Scott. I'm glad to be here. Being a pioneer, that just means I'm really freaking old, but okay. We'll go with that.
Fair enough. A pioneer for sure, and you'll be forever young in my eyes. Now, you've been talking about the emotional side of diabetes for a long time now, and that's exactly where I want to start for a few minutes, especially for those who maybe are not as familiar with you and your work as I am. If I asked you to summarize the messages that you've been sharing about the emotional side of diabetes throughout your career, what would your response be?
Well, I feel like I'm preaching to the choir here. I mean, it seems so ridiculous to have to tell your audience, and mostly people with type 1 diabetes, that guess what, guys? There's an emotional side to diabetes. You know that, but it has been remarkable over all the years I've been working in this field, which is getting pretty close to 40, how few healthcare providers recognize and address that at all. But probably that's the most important thing that I've spent all these years learning quite humbly from all the many thousands of people with diabetes I've met over the course of the years to understand the degree to which there is this very, very important emotional behavioral side of diabetes that's an enormous contributor that what can make people feel so miserable, but also really can provide such oomph and impetus to help people manage diabetes effectively and successfully, and to not have to feel so overwhelmed and so burdened by it. So there's opportunities, and it's just really just the recognition that this whole touchy-feely side is a really big deal. And we want, for people with diabetes to know, if you're ever feeling like overwhelmed and freaked out, man, you are not alone.
Yeah, that's great. You've done a lot of research and clinical work around things like you've mentioned, the diabetes distress and burnout. Can you talk a little bit about some of the early things that you discovered that surprised you?
I guess I should start by talking about where did this whole idea of diabetes distress ever come from? Many, many years ago, as you know, I used to work at the Joslin Diabetes Center in Boston. And the healthcare providers there would send me lots and lots of patients to see. And the consult form would always say, please see this patient. This patient is in denial or non-compliant.
Okay.
And that was usually about it. And what was really striking in those early days, every single person I met, I went, this person doesn't really seem in denial. And I don't think calling them non-compliant is particularly very nice and actually not very accurate at all. But there was something else going on. I mean, people were just, freaked out, overwhelmed, et cetera. And so with my colleagues, we began to think, well, what do we call this? And really this idea of calling it diabetes distress is really what came together. And so we began to do a lot of work, not just to learn from our patients, but to do research to understand this and find different ways to assess it. So it was really, again, the surprising thing, I guess you could say, or what we learned was how important this issue was.
Yeah.
I can tell you more about what was really most surprising, though, about
Yeah,
them.
please do. Yeah, we'll come back to, we're going to dig into diabetes distress in a little more detail in the next question, actually.
Okay.
So let's follow that other train of thought that you had to the other direction.
Well, I mean, if you work in this field and you're open-minded, you have to be surprised every day. And I'm thinking very, very early on, we were just starting to formulate this idea and realize, wow, people are really fed up with their diabetes and freaked out and burdened, et cetera, et cetera.
Yeah.
We said, let's bring together people in a group and see if we could really help them. And this was really primarily my idea, so I take full credit for the incredibly stupid thing that we did. We said, well, let's see, psychologists, we know a lot about stress management, so we'll teach people relaxation exercises, and we'll talk about how to reframe things so that you don't have to feel overwhelmed by life. Very traditional stress management kind of interventions. And to my surprise, everyone in this group just got really mad at me. And luckily I listened to them. And what they were telling me was, what are we doing this stress management for? This is not what I'm here for. I'm not stressed out about life. I'm stressed out about freaking diabetes. Let's talk about that. I went, no. We're going to all practice just relaxing. And they're going, screw you. This is ridiculous. And luckily, I listened enough to them to say, okay, wrong idea. We really have to stick with what's really going on with them. Throw away all of our preconceived notions about what's important and how to address this, and have them teach us about what they need and what really can make a difference. So I guess I'm happy and proud to say on my clinical side, as well as my research side, that I feel like I'm still surprised every day, but that's one of my earliest memory of being surprised.
Let's dig into diabetes distress a little bit more. For someone who is listening who may not necessarily be familiar with the term, can you tell us what exactly is diabetes distress?
Well, diabetes distress is, it's kind of emblematic in the name. It's this very, very, very common feeling most people with diabetes experience, both, and that includes type 2 diabetes as well as type 1, where you just can feel this sense of pressure and burden of living with diabetes every day. And it's important to say, this is not pathology. This is not like a mental health diagnosis, like, if you have diabetes distress, you're messed up. It's to be expected. And it's to be expected of what we understand, which is everyone, I'm sure you understand, is the day you develop diabetes, the universe said, hey, congratulations, I have a job for you to do. You get to do it forever. Congratulations. You can't say no. There's no pay. There's no vacation. So, hey, good for you. And anybody would ever have that kind of experience about having this extra job with no pay and no vacations that you have to do, man, who wouldn't get sick and tired of that? And then you add sort of this other element of like, well, how is this going to affect my life? And my life could it be shortened? And how is this going to affect me? And what about people around me? And all the huge permutations and ways in which we understand that diabetes can just really annoy you and really make things tough. And we've continued to learn about new ways in which diabetes can drive you crazy over the years. So I don't know if I can be more formal about it, but that really is what diabetes distress is all about.
Why is it so important to accurately diagnose diabetes distress or talk about diabetes distress? And a related question to that is it true that diabetes distress can sometimes masquerade as depression?
Yeah, good question. Well, first of all, I'll put on my research hat to answer that. One of the things we know about diabetes distress, first of all, diabetes distress is very, very common. That our best evidence suggests that maybe 75 to 80% of people with type 1 diabetes experience some significant diabetes distress right now.
Yeah.
Then there's what we call really chronically elevated distress. People are just really fed up and overwhelmed most of the time at very, very high levels. And one of the things we know, especially as diabetes distress gets bigger and overwhelming in your life, one of the reasons why it's so important to talk about it is it's sort of like a ball and chain around your leg. And it definitely makes it harder to put up and manage diabetes day to day. So we have lots of scientific evidence that show that people who score high in diabetes distress tend to have higher blood sugars, tend to have or I hate to use the word poor, but tend to have higher A1Cs. If they have CGM, they have less time in range.
Yeah.
That diabetes stress just makes it tougher.
Mm-hmm.
And that's not true for everybody. There are people who, in fact, have fairly tight control of their blood sugars and have what looks to be like great, quote unquote, A1Cs, and they're still miserable. They'd be miserable because they're putting too much time and effort in their diabetes. They're being dragged down by that. So it's not a perfect correlation, but one of the big reasons we talk about it is here's this huge burden that makes it harder for people to be successful to manage diabetes effectively in a way that they'd want to do.
Yeah. And tell me a little bit about the danger of it masquerading as depression and what that can lead to. And where I'm going with this question is being able to give help and proper help. So if I'm dealing with diabetes distress, taking an antidepressant isn't necessarily going to help me much with that problem.
Yeah, and that's a good point. We talk to clinicians about this a lot because that gets confusing to them. And so oftentimes they'll they'll give you a questionnaire if you see your doctor, often a depression questionnaire, and say, look, you score high in this questionnaire, you're probably significantly depressed. We're going to refer you for treatment that you're going to probably not want to do, or there's medication you're not going to want to take. And there's a huge problem with that. First of all, we used to think that depression was extremely common in people with type 1 diabetes. And I was unfortunately part of some of those studies. So we would say, people with type 1, there's like 30, 40% or more who have really chronically elevated levels of depression. And what we now realize is that was wrong. People were scoring high on these depression questionnaires, but it turns out those questionnaires weren't exactly measuring depression. They were really picking up something else. What they were picking up was how fed up and overwhelmed and distressed people were about their diabetes. And as you mentioned, giving someone an antidepressant pill for diabetes distress doesn't accomplish anything.
Yeah.
And by the way, we also have pretty good evidence that high levels of depression, which still surprises me, isn't really that strongly related to how well you're doing with your blood sugars. It's really diabetes distress that's the issue. Now, where's the confusion? And the confusion is because of what they have in common. So if you've ever been significantly depressed, what that means from a psychological or cognitive point of view, for most people, is it feels like things are bad. Bad things are happening around you, and you feel powerless. You feel like there's nothing you can do about it. And as that grows, that's really the cognitive nut, the core of what depression is about, although can be biological aspects of that. And really the core of diabetes distress is similar. It's feeling powerless and out of control with diabetes. And that's why there's often this confusion. But, I was part of a big international study a couple of years ago that suggests in type 1, you might have 10, 15% of people who would meet criteria for having a clinical depression disorder, 10 to 15%, where diabetes stress is going to be 50, 60, 70, 80% of people. I mean, what do you think we should focus on? So that's really the big issue. And by the way, if you're seriously depressed, that's really terrible. I mean, we know that can really be an awful thing to have to deal with. And we have lots of ways of helping people. So I don't mean to say it's not important. I'm just saying it's not as prevalent.
Yeah.
And it's really not the most important thing we need to focus on.
And you bring up a great point there, because it is possible to have both, right? Clinically diagnosed depression and be significantly distressed about diabetes. And that needs to be handled appropriately as well.
Yes, we are great. Humans are amazing. We have wonderful ways of driving ourselves crazy. We can be depressed, we can have diabetes stress, we can all sorts of awful things happen. All in combinations.
You've been sharing these ideas for decades. What parts of the message do you feel like the world hasn't fully heard yet?
Which world? You mean healthcare providers? You mean people with diabetes? You mean, depends who you mean. If we talk about healthcare providers, I think there has been a slow growing recognition that the emotional side of diabetes is important, but certainly there has not been a recognition or appreciation that healthcare providers can and should do anything about that. And it's not because they're bad people. It's because usually they're just so overwhelmed with dumb other stuff they have to do. Yeah. And their appointment time with you, people with diabetes, is so limited. Now, they may also not have the skills to do that either. But, to do something other than treating people with diabetes as their numbers is really what this is all about, and why that's so absolutely key. I think for folks with diabetes, I still don't believe that most people with diabetes recognize that as they're feeling overwhelmed at times or scared or pissed off, I don't know if they recognize how normal they are. And that it would be almost weird if they didn't feel that way. That when you're having a tough time managing diabetes, or you're just feeling sick and you want to take a break and you hate it and it's driving you crazy, or whatever that emotion is, there's an enormous number of other people feeling that way. And that in and of itself is so important and so healing. And I think it's just because people with diabetes can still get so isolated, which is the reason I'm glad you're doing this podcast, and why I'm glad that Blue Circle Health exists. It's easy just to feel like you're the only one in this boat. So for me, the most important message that most people still don't hear is, if you're ever getting burned out and overwhelmed by your diabetes, that's normal. It's super common. It doesn't mean we can't do anything about it, but just know that I'm reaching out to you with a big old hug and to go, welcome to a big club. It's okay. And it's understandable how this happens, given that you're trying to put up with this tough job you've been given.
Yeah. Thank you for that. Can you maybe explain or describe some signs that someone might be dealing with diabetes distress? I want to help the listeners recognize if they might be experiencing this themselves, and are there any tools that might help them?
In terms of what you might recognize, probably the most important thing is you recognize that dealing with diabetes every day is just seeming harder and harder. It's hard to find the oomph you need to put up with this idea that you should be bolus-ing for a meal, or just feeling angry from time to time about feeling you don't want to do this anymore, this need to take a break. I say all that and again want to emphasize how normal this is. Yeah. But it's a sense of being worn down. It'd be just like having a job, any job, where you're working 15 hours a day, every single day. And within a week or two, you're going to go, I'm not sure I want to keep doing this. Yeah. And you also begin to, at the extreme, begin to depersonalize. So you begin to kind of distance yourself from it. It's like, this isn't even me, it's something I have to do, but maybe I'll just stop thinking about it for a while. I'm being a little vague because it's so hard to capture. But I want to answer the second part of your question. There's some very easy ways to begin to assess and measure and decide how distressed you are, because we made up most of those measures. Great. And the easiest way is to go to this website, diabetesdistress.org, diabetesdistress.org. And at that site, you could fill out one of a number of our different questionnaires. I would recommend you probably take the most recent one and the best one, which is called the Type 1 Diabetes Distress Assessment Scale, T1DDAS. And you'll see it there. You can fill it out. It's completely anonymous. No one's ever going to see the results except you. You fill out this questionnaire. I think it's 29 items. It's automatically scored. It'll show you what your score is. It'll tell you what it means. Unfortunately, this current version, it won't tell you a lot about what to do about it, but it'll at least give you a sense of how big of an issue is this for me. And because it has a whole bunch of subscales, because we know there's different things you can be distressed about, it can help you pinpoint the sources of your diabetes and stress. Is it really the fact that I'm feeling hopeless about my future, that diabetes means I'm doomed? Does it mean that I'm just having trouble affording diabetes? Is I feel, my family members don't care? There's different things that can contribute to this. And by helping you figure out what's the source or sources that are most important, it can then open up what to do about that. So I highly recommend that site. It's completely free. It's totally anonymous. Go for it. Diabetesdistress.org.
Diabetesdistress.org. We'll be sure to get that in the show notes. And is it something that once they've gone through it, they can maybe print it out and bring it to their healthcare professional to start having some of those discussions?
Yeah, I should have mentioned that. Thank you. Because it's anonymous, the system is anonymous. It can't save anything. Yeah. So if you do want to save it, you do need to scan it, go into a PDF, or you can print it out directly from that site and take it to your healthcare provider and wave it in front of your healthcare provider's face and say, "I got a couple extra things to talk about." That's can be very worthwhile. Say, "This is areas where this is what's driving me crazy, and I could use some help."
This is a great place to take a quick break. When we come back, we're going to talk a little bit more about what actually helps and what people with diabetes can do when the emotional side of this condition starts to feel heavy. One of our favorite things is sharing stories from people who've participated in the program. And I'd like to share a story I have here from Rachel in Florida. She's been living with type 1 diabetes since 2024 and participated in the Blue Circle Health program recently.
I got diagnosed when I was 26. It was so much to try to understand. I really felt knocked down. And I think that was because I didn't have the knowledge that I do now about just what it's like to live with this kind of disease. And I'd get some very surface level answers when I knew that there was more to it, like a circle of just questions, despair a little bit, and just frustration. It didn't seem like there was an end in sight. And I felt very alone. When I started Blue Circle, I felt like I was in a hurricane. I didn't know how to help myself. I didn't know how to help my parents. I didn't know what power I had. I felt like I was just this lost, confused patient, but really just talking to Eleni, Rita, Catherine, Xanadu, I can't say enough good things about them. I would have them above, on my wall, honestly. I mean, they took the time to not only help me and answer my questions and help me inform myself, but help me inform and educate my parents and everyone else in my life, in my circle. And it was such a great experience of just reframing how I think about my disease and then how everyone else thinks about it, right? One of the best things that I got out of the program was my sense of advocacy for myself. Just speaking with Eleni as much as I did and Catherine and everyone, they really gave me a sense of courage. I feel so much less alone. I feel so much more empowered. And my management has improved so much. And honestly, part of that has just been the mindset shift that comes with the all this empowerment, all the information. It was just incredible. I know that there's so many people out there like me that need you, that need Blue Circle Health.
Wow, Rachel, what a moving example of what we hope to do here. Thank you. Now, before we dive back in, I want to make sure you know about a helpful resource. And listen, this is not an ad. There's no sponsorship involved. In fact, they don't even know that I'm doing this. Today, I'm talking about the Mental Health Professional Directory from the American Diabetes Association. This directory is a quick way to search for mental health professionals in your area. You can search and sort by distance, ages seen, languages, and even special interests. You can find the directory at diabetes.org and then click into the Tools and Resources menu, and you'll see Mental Health Provider Directory in the list that drops down. So if you're looking for help with the mental and emotional side of T1D, this might be a great place to start. It's also a great idea to talk to your healthcare team and see if they have any recommendations. Welcome back. We've been talking about the emotional burden that can come with living with type 1 diabetes, but there are also ways to navigate that experience in maybe healthier and more supportive way. So, Dr. Polonsky, when someone realizes they might be struggling emotionally with diabetes, what are some helpful first steps?
Well, again, putting on my clinical hat, I can tell you the majority of people who come to see me because they're burned out or overwhelmed about their diabetes probably don't really need to see me. Well, let me say, actually, they probably do need to see me. But what's even better than seeing me, they could see in place, is if I could have the opportunity simply to introduce them to a whole lot of other people like them living with type 1 diabetes every day that, again, people end up feeling so isolated. And as you know as well as I do, when you help to bring people together, whether that means local meetups like as we have here in San Diego, and you're aware of the various ways we can do that. A lot of that's going on nationally now. We know our friends at Taking Control of Your Diabetes have a program once a year, other organizations as well, when you can help people just hang out and meet each other and be in a big room together and realize everybody's beeping. There's something so amazing about that, right? It's weird if you don't have diabetes in that room. And that's by far the most remarkable thing I think I've ever seen. It seems to make a difference. I know I've told you the story long ago that when we used to do a lot of, before the pandemic, lots of group programs for people with diabetes, especially type 1. And we bring people together in groups of 10, 12, 15 people. We'd meet once a week for maybe 6, 8, 10, 12 weeks. And at the end of every program, I would usually go around the room and say, hey, you've been coming here every week. What have you found, if anything, of any value about being in our program? And to tell you the truth, when I first started doing that, I was fishing for compliments. And so you can imagine my disappointment when the first response I heard was Harry over here would say, well, you know what I really liked? I got to meet Bob. Bob really gets it. He knows where I'm coming from. I went, yeah, okay, that's nice. Yeah. And Sally would say, it's been great. I got to meet Barbara. She really gets it. She really knows what's going on. I went, okay, wait a minute here. What's happening here? And I began to realize that here I thought I had given such wisdom and helped all these people so much, but really I was just the host of the party. And by helping people meet each other and brainstorm and listen to each other and realize, just take a deep breath and go, oh gosh, someone else kind of gets this and understands this and put up with the same stuff and maybe has a solution, maybe not. That was by far the best thing. So any creative ways we can help to bring people together, ideally in person, I think not as good, but sometimes online if it's in some moderated fashion. So we force people to be nice to each other, really is by far the most important thing. I'll stop for a minute because I can talk about a lot of other things, but that's the biggie.
I love that. Community has been such a big part of me and me feeling like I'm living well with type 1 diabetes. What are maybe some small mindset shifts that people with diabetes can strive for that might make living with diabetes feel a little more manageable?
I would say the other biggies that we talk about a lot, one has to do with what we call evidence-based hope. That even here in 2026, we know that so many people feel doomed, that diabetes is going to get you, that your life is going to be shortened. You're going to end up with horrible complications. You're going to have your legs cut off and you're going to be blind. You've heard all these awful, awful things. And people rarely hear the good news. What doesn't get told enough, which is what the evidence tells us, is that with good, and I'm going to say this broadly, with good care, odds are pretty good you're going to live a long and healthy life with diabetes. And as you know so well, Scott, we have spent a couple decades simply accumulating all the evidence to document how true that is. That we can't make any guarantees, but it's the opposite of what we typically tell folks, which is if you don't behave, here's where the bad things are going to happen to you. But we know for a fact, especially here in the U.S., that we have more and more people living long, long, healthy lives. In fact, it's turning into a problem, right? So we have our friend Joanne Milo who started this new group by T1 to 100, where now we have this problem of these damn people with type 1 they're not dying, they're getting older. And now they're freaking out about, well, what happens when I get so old? I'm not going to lose my marbles and not be able to use my technology well enough, and who's going to take care of me? Like, whoever knew we'd have problems like this? And it's a problem, but it's wonderful.
It's a great problem. Yeah, absolutely. If someone listening today takes just one thing from this conversation, what do you hope that is?
First of all, if you're going through times when diabetes is driving you crazy in any way, you are freaking normal. Okay. It is understandable that's happening. Number two, you want to know what to do about it? The most important thing is don't do diabetes alone. You need people in your life who are rooting for you, whether that means getting your family and friends on board, whether it means having a healthcare provider who really cares about you, whether it means reaching out to finding, meetups or groups of people with type 1 diabetes in your area, region, or even online. If there's any way, anything you could do so that you don't have to be alone, that you can meet others who are maybe doing better than you, maybe doing worse than you, but who have also dealt with, diabetes stress over the years. You can laugh, you can cry. By far, it's the most important thing to do. That's what I'd say.
Very well said. Well, Dr. Polonsky, thank you so much for talking with me today. I'm eternally grateful for the benefits of your work in the diabetes field, and I feel like I've personally benefited from much of your work over many years. So I just really appreciate you taking the time today.
That's really my pleasure. Thanks so much.
Thanks so much for listening today. If this conversation resonated with you, I hope it helps you remember that the emotional side of living with type 1 diabetes is real, and you're very much not alone in feeling it. If you're looking for support, you can visit bluecirclehealth.org to see if our program is available in your state, or talk with your healthcare team about getting help with the emotional side of diabetes. And I hope you'll tune in for our next episode. Until next time, keep living well with T1D.